you. Thank you all for coming. I know there's lots of wonderful talks going on right now at UTV, and so thank you for being here. As she said, I developed a framework for differentiating social from non-social communication, and so I'm going to start by really unpacking that framework. And then from there, I'm going to use that framework to show you a study that I did, as she said, that was funded by the Department of Disabilities, Texas Department of Disabilities of the Texas Autism Council, that uses that framework to identify intervention targets. And then if there's time, I'll just show you where I'm going with that research now. So this is the framework that I use, and what you'll see is that, I developed this framework because social communication is a core deficit in children with autism. And so it's really important for us to understand what's social communication versus what's non-social communication. And so for me, this framework is designed, it is based on 4 developmental processes that combine and create 3 different levels. So the first part of my talk, I'll be really just going through each one of these levels and showing you how they interrelate to create these 3 different levels in children. So the first strand I'm going to go through is social cognition. And in early development, around 2 months of age, the children begin the social smile. Most of you who've had children or been around children, you know up until 2 months of age, the child's a ball of reflexes, and then all of a sudden one day that social smile comes and people say, ah, my baby's human, my baby's really looking at me. And this is called sharing emotions. And it is a dyadic interaction. And by dyadic, what I'm talking about is face-to-face. You're interacting just with another person. There's a lot of eye gaze going on at this time, mutual gaze between the caregiver and the child, and there's a lot of vocalizations and back and forth, if you vocalize with your child, back and forth vocalizations, so much so that it almost looks like a conversation. And this has been called ProtoConversation in the literature. At 6 months of age, something special happens. The child becomes interested in objects. And so it goes from dyadic to triadic. And what I mean by triadic is you have the child and the caregiver and a third object. So the third object makes the triad. And most people don't spend a lot of time unpacking the 6 to 10 month old level range. And this comes from the work of Michael Tomasello, who's really studied this in both non-human primates and humans, looking at what are the skill levels that happen in what he calls sharing perception and pursuing goals. During sharing perception and pursuing goals, the 2 people, the child and the caregiver, are experiencing the same thing. This is different than experiencing the same thing and knowing they're experiencing the same thing. So during this time, the child is goal-directed. They have selective attention to what it is they're interested in. They can persist until that goal is met. They're happy when the goal is met, and you know what happens when the goal is not met. They also understand others. They can monitor the other's actions, and they can predict what comes next. So in this situation, the mom's pointing to a block. The child might say, oh, we've done this before. We're going to make a block tower. And the baby might put a block on the first block. And they might start taking turns, alternating, putting blocks and making a tower. And they're both focused on the block tower. What's not happening when they're in sharing perceptions and pursuing goals is the baby doesn't pick up the block and go, oh, do you see what I'm seeing, right? Are we going to share this block together? That doesn't happen until starting at usually 10 months, really getting more into the 12 to 18-month-old level, where they get into the sharing attention and intention stage. Here there's a shared goal. Now they know they're experiencing the same thing. They have mutual knowledge that they're doing something together, and this is often denoted by the 3-point gaze shift, or what I call coordinating joint attention, where the child looks at an object, looks back at the caregiver, and then looks at the object again. They can also coordinate their plans. They understand both roles in an interaction. That's why games like patty cake and peekaboo are so important, because there's 2 roles in the interaction, and they know that they can reverse those roles. So, I'm going to show you a couple of videotapes that I've taken from the Autism Speaks video glossary to just exemplify what it is that I'm talking about. So this is an example of a baby who is so far we don't see any evidence of sharing, and there's still no evidence of sharing. Now she looked up and looked back down. That was a 3-point gaze shift, showing evidence that she was sharing with the clinician, who you can't see who's up there.
It's an ice cream truck. Ice cream.
And back down to share with the clinician. Another nice sharing. Okay, so let's contrast that with this little boy who's at sharing perceptions and pursuing goals.
More bubbles? More bubbles?
He has very selective attention to the bubbles.
Do it again? What are we doing again? No?
He wants it. He's persistent.
Can you give up to Macy? Open? Open? Mama bear.
And now that mom's opening it, he comes down because he can predict what's happening next, that she's going to be blowing the bubbles.
Bubbles. Yay. More bubble?
I'll show you another one. I like this one because he's happy. Here you see their turn taking.
Yes.
And he likes this interaction, but notice he really never looks up at the caregiver or the clinician until she puts her hand there. So this is also an example of some of the skills that children can have when they're sharing perceptions and pursuing goals. The next strand of the model is intentional communication. And about 9 to 10 months old, babies become intentional. At this point, they have nonverbal communication, but they do several things. They can influence others' behaviors by requesting and protesting. So we've all seen babies do conventional requests. They don't need to have your thinking of your baby as I'm talking about this. So they can influence others' behaviors. It's not until they get to about 10 to 12 months of age that they can influence another person's mind. And this is done when they begin to point or to share attention. At this point, the baby knows that you could be looking at anything in the room, not necessarily what the baby is looking at. And the baby wants you to look at what they're looking at. They say, you can be looking at anything, but I'm going to point and I'm going to look back at you to see if you're really looking at what I'm looking at, because I want to share this with you. And this is a really important step for a baby to do. We're going to look at a couple of pointings.
Bye-bye. Do you see the bird up there? It's the parrot. What do you think? Huh? Which book do you want?
Beautiful little pointing. And this one's really cute too. This is a cute little 12-month-old.
Pop. Oh! it. Very nice. There you go. They're pretty.
I love this one. See, Mom? You're looking at my bubbles.
Is that Mama open?
No. See? You can see my bubbles. I'm not giving them to you. Okay, I'll give them to you. Okay. So there's a lot of wonderful sharing that happens there. Now, let's talk about how this relates to language. Especially my early work looked at the continuity between early social communication and later language. And one of the things that we found was that intentional communication, when you have behavior regulations, if you begin to talk, it gets you to isolated words. And sometimes if you stay in this stage, it can get you to phrases. So you have kids on the spectrum, for example, who can say cookie to request, or then because we have wonderful speech pathologists who are looking at it from a linguistic model, want to increase the mean length of utterance so the children can say, I want cookie please, a lot. And they are going on, and people are asking, well, why, they have all these words, why aren't they really having language? It's really, you need that shared attention to get to that true rule-governed language. And so when we look, so like how does this kind of happen is one of the questions I've had. And if we look to the Emergentist Coalition hypothesis, which is Kathy Hirsch-Pasek and Roberta Gollenkoff and our colleague Mandy McGuire worked with them and uses this model as well. They suggest that there are multiple mechanisms for learning words and learning language, but they change in their importance over time. And so these first two here, what we find is that, I'll put it this way, that infants and children that I'm going to say are in level 2, they rely heavily on associating perceptually salient information with what it is they're hearing, temporal contingency. So they are pairing basically what they're hearing and what they're seeing. And some of my work I've done here with Carol Troutman when she was a doctoral student, we found the evidence of this in mother-child interaction and more naturalistic work, where the parents actually, every time they talked about what the child was looking at, they shake the object or they move the object in some way, suggesting that they were making that perceptually salient. Then we have toddlers and level 3 children who they begin to rely more on the social cues and what is intended. So if we put this all together, right, we have children who are sharing perceptions and pursuing goals. These children can use behavior regulations, they can request and they can protest. And if their child who is delayed and they stay in this stage, they begin to use words, they begin to use words to request, and they also begin to use words to label. Labeling would be labeling would be labeling items in the environment like water bottle, pizza, book, without ever looking up to the adult, without ever sharing that information with the adult. So it's words without sharing that information. Children who are sharing attention and intention, they begin to direct attention. They can be doing this non-verbally, but once they begin to talk, they begin to comment. And that would be now using language to share with another individual. So let me just show you this video.
What is it? What is that?
A star.
A star. Good boy.
Great job.
Great job. What is this? What is that? It's a tree.
Okay, so what's going on here? He's labeling. This child is labeling. The child is in shared perceptions and pursuing goals. What makes this interaction look shared is the parents are coming in and sitting with him and sharing the experience with him. Notice he never looked up. He also was taking turns with his father, another skill that you can do in sharing perceptions and pursuing goals. This child can take some of our language tests because he can label. So this child could not qualify for services, even though he was autistic. They would not qualify him for services because he was a labeler. These are the kids who break my heart. These are the kids who early intervention makes such a difference to. If we want to get to optimal outcome, we need to start early. And these kids get overlooked because people don't always understand that the level of sharing perception and pursuing goals. I have a kid who's commented, but I'm not going to show you that. He looks up. Okay? So this is the developmental framework that I've been working on. I've been showing you the different levels of sharing emotions, sharing perceptions where they request and they label and they have isolated words, and then sharing attention and intention going into true language. Now the problem with this model is that children go through this developmentally, but level 2 is not social. Level 2 is really just a step on the way for typical kids, but kids on the spectrum get stuck there. And this is a problem because people tend to keep them with words and ask them to request and ask them to label and begin to increase their mean length of utterance within this. The people who are in applied behavioral analysis, they call this manding and tacting. Manding is a request and tacting is a label, and this is what therapy is about. And I contend that if you want true social communication, you have to go from sharing emotions to sharing attention and intention. So you might ask, I think it's got here, why aren't they sharing emotions, right? Well, I think we get some clues on that when we look at the work of Amy Klein and Warren Jones. And their work has shown that children with autism have that early reflexive gaze as typically developing children do. And sometime, you see this is dyadic, right, and triadic. Sometime when they're leaving that dyadic stage, and many of the children do have some of that dyadic interaction, they begin to lose eye contact in a way that typically developing kids don't do. And what they say is that they're going more and more at looking at objects, and they become object-oriented, versus typically developing kids are making more social interactions. And what they say in their articles is that there's some neural mechanisms that are not being activated because they stop looking at faces. And so that would say that if you've got children early intervention should focus on some of this early dyadic interaction and trying to work on the neural mechanisms that we have in terms of looking at faces and looking at eyes. So with that, I did a study last summer that was really asking what the extent does intervention focusing on level 1 skills, sharing emotions, eye contact, social engagement, reciprocity. What does that affect change in early social skills for kids who are already in level 2, for toddlers who are in level 2? So this is level 2 kids. I'm going to go backwards with them. And the kids we used were all IDEA Part C, that's early intervention children. And we were using a parent-mediated intervention program that was designed by the Pathways Early Intervention people. This was Renee Hoffman and Michelle Campbell, who are the owners of Pathway and designed this intervention. So we had 4 children. They were all under 3. They're all in early intervention. I want to point out that 2 of them were bilingual, and it's not indicated on here, but one child was biracial. and they all were research diagnosed as having autism based on the ADOS-2 and the CARS. They also had been receiving traditional early intervention services, right? So 3 of the children had been receiving services for almost a year and about 2 hours a week, and 1 had just started. Okay. So this was a single subject design, and it was, the interventionists made weekly home visits. They used a manualized intervention, so we protocol, and to coach the parents, and we looked to fidelity with the parents at each visit. And we took 10-minute parent-child interactions at each visit, and then they sent them to my lab, and we coded them in 10-second interval coding. And I'll talk about that again in a second. I just want to show you an example of child 4 during baseline. This child was in early intervention for 13 months. The parents were told they could do whatever they knew how to do, business as usual. Notice the child really never looks at the mother. And there's a focus on requesting and labeling. They can take turns. And this goes on like this. Now, I think that this is really, really good therapy if the child has joint attention, but the child doesn't have joint attention.
How old is the child?
This child is 32 months and had been in early intervention from 22 months. So let me just orient you to the graph. These are my results. I did 10-second interval coding, so in 10 minutes we would have 60 intervals. These are the number of visits. Blue is baseline. We had, red is called learning environment, where we weren't really intervening yet, but we were telling the parent how to set up the environment, so we did do something, but it wasn't the therapy that I was looking for. And then we started the therapy in the green. And this is points of non-overlapping, percent of non-overlapping points. And I measured this from the green and the blue, and I didn't measure the red. And you see, visually, you see that for social engagement, that is looking at the other's face and smiling, looking at the eyes and the face and smiling. It looked pretty effective for most children, and not as effective for child 3, but it's interesting that child 3 had some of social emotional skills during baseline. So that was social engagement. We looked just at eye contact as well. I don't know if you noticed in the videos, the mom was wearing glasses. Those were spy glasses, so there was a video camera in the glasses. So we had 2 streams, and we could see whether or not the child was looking up at the mom. And for eye contact, all but child 3, it was effective. I have to mention this point here. What happened there, this was a child that you saw. Look at baseline. And you see the same thing here during baseline. He wasn't smiling. This one, he was smiling, wasn't smiling here. He wasn't smiling, so he wasn't smiling in eye contact. What we tell them in learning environment is to back off. Stop asking your kids questions. Just back off, you know. And there's something called the still face phenomenon. And Jacqueline Nadel has found that children with autism when you go still face, they begin to look at you and really touch you and really are wondering what's happening. So they have some information about contingency, and when you stop being contingent, they look at you. So this, to me, when you really analyze the mom, there's really a still face phenomenon that was going on during that time point. So that's eye contact. Okay, verbal reciprocity, that's back and forth vocalizations. It was fairly effective and highly effective for both children, for the children. Okay, so I want to show you, this is 4 weeks of intervention for the child that you saw. You got to get rid of the objects. Notice he's looking at her. Notice he's smiling at her. Notice he is having reciprocal interactions with her. This mother told us that when she used to work with her child for that year she was in early intervention, it was a struggle and it was very difficult, and now she feels like she's going on dates with him.
So Pam, what did you tell the mom to do to get that kind of change? What was the intervention actually?
The intervention was that we first tell them to back off and then find their favorite things so that they want to come and interact with you, and at first to let them have what they want. And then it is very different for me because it is a much more of a behaviorist approach than I typically do. But then it is to have what the child wants and get the child to look at you. And it's not asking the child to look at you, but it's really getting under there and looking at the child and then reinforcing him with what he wants in the social game or for some other reason. And so what we find is that you do that for a while, and then the child begins to know to look at you to be reinforced, and then they begin to look at you more and more and more. And then we start the imitation and the back and forth interaction.
What does it mean to back off?
Not to keep asking the child questions. Not to keep bombarding them with do this, do this, do this, do this, do this, which is a lot of what people are told to do, especially if they're in applied behavioral analysis, and to just limit the amount of words that you're using.
Gotcha.
Thank you. I want to show you one more video of this child. The mom wanted to give us this video. It was about a month after we finished the study. We did not have enough money to go back to the families afterwards, but this is him with his father.
Okay.
Looking, smiling, talking.
It's cute.
So you see that this child had some words before, and so there he was able to transfer that sharing emotions and learning that reciprocity and into what other skills that he had in terms of words. But you see he's much more connected with his father in this video than you saw in the videos with the mom. This child was really hard to code because he had 8 weeks of baseline, and it was like nothing. So the summary of this is the study, before the study, children was receiving general developmental services that focused on verbal communication outcomes, and such as labeling and requesting, and the children exhibited no apparent progress in core social communication types of skills as evidenced by performance during baseline. And in contrast, all children made substantial gains in early social communication once intervention focused on maintaining face-to-face reciprocal social interaction and eye contact. And why this is really important is really looking at the difference between general developmental services that are evidence-based for other children and children with autism. And this study, the reason it was funded by the state of Texas is because we're trying to look at different models to help the kids on the spectrum when they are in IDEA Part C services, and that are within the philosophy of early intervention programs. So that is why we used early intervention children. Before I finish, I can ask some questions, but ask for if there's questions, but I also want to tell you what I'd like to do with this information. When I started this study, I really had no idea how it was going to go. The Pathways women were really devoted about their therapy. They felt that they were getting some really good results, and I figured, I'll see if it works, right? And so I really didn't know what was going to happen. And once I worked on this study with them, I became a believer, and it fit really well also within my framework of what's going on. And so I thought that was really interesting. And so now what I'm doing is I'm doing a pilot study to see if I can replicate the results with the kids, some of the kids in the pre-verbal program at Callier Center. And I really like being able to do this. We only have one child that we've been working with because it's also lets me see the children and refine my theory about what's going on and the generalization and the carryover from the skills that they have in level 2 once they start having the sharing perceptions. And so I'm finding it really interesting. I'm using graduate students. Someday maybe I'll be able to use parents, and we want to obtain eye tracking data. And so I've been collaborating with Julia Evans on looking at eye tracking data. She's been very kind to put a very expensive eye tracking piece of equipment in my lab. And this is very preliminary. Holly said it was okay if I showed it, right?
Did I?
Yeah, he said it's okay if I showed it. This is 5 weeks of baseline, and what I want you to do, we haven't analyzed it, just look at the yellow circle, okay? This is 5 weeks of baseline, so he knew the clinician very well. We went 5 weeks versus 4 weeks because I was trying to figure out the eye tracking, and I wanted to get before eye tracking, and this is 9 days of pre-verbal afterwards. So let's look at the yellow dot. So if you can see, we could probably turn off the light. He's looking over here. Someone turn off the light. He looks at her nose. He looks at the bubbles, of course. He's looking in the corner. I should go like this. Looks at her nose, looks all around. Of course, now he's going to look at the bubbles wand, so that's going to be up there. He just looked over here. I did have sound, but I don't have it on this video. I don't think it needs it. And he is looking in through here, looks at the bubbles. But what you saw in the very beginning is he was here, and he was here, and he was here, and he was fairly disjointed with it. And we don't know whether or not it's meaningful in terms of looking at it in calibration, whether or not the fact that he's looking fairly down here when he looks at her. But that goes along with the work that people have found in eye tracking with individuals with spectrum that, on the spectrum, that they tend to look at the mouth and not towards the eyes. So this is now the same video, and this is after 9 days of using the intervention. And what you notice is that he's not all over the place. He's really staying towards her eyes. He looks at the bubbles, looks back at her eyes, and is really staying there. He's not looking at things all around the room. Looks at the bubbles, looks up at her eyes. So he's much more oriented. It appears that he's much more oriented on her face than he had been just 9 preverbal days before that. So, okay. So that's all I had to show you, and now I'm waiting for Dr. Stillman to give me the hard questions.